watched my last video, you already know private medical practices are failing at an alarming rate that we haven't seen in over a decade. And most don't realize it until it's too late. And if you haven't watched it yet, pause, go check it out, and then come back, because everything we're about to talk about in this series builds from that foundation. If you're running a private medical practice in 2025, there's a good chance that your team's showing up, your patients are coming through the door, and you're still wondering why your numbers don't reflect that, or you're not even tracking anything. And just like the other medical practices that went under, you don't know what's happening. For the last 10 months, I've been working closely with private medical practice leaders who feel overwhelmed. They know something's off, but they don't know where to start. The team is there, the patients are there, the business is still struggling, and they feel very overwhelmed with all the new changes. So I'm helping them shift their team from task-driven operations to outcome-focused strategy, from reactive chaos to intentional action throughout the organization, from just doctoring to actually running an efficient medical business. So now I know when I say efficient medical business, you're probably thinking like new software, better operating reporting systems, more automations, more staff. Not quite. Because if you want to lead a medical practice in 2025 that actually survives the next shift in reimbursement, you don't start with software and new people. You start with clarity. Most consultants want to start with this type of approach. They want to optimize operations, increase profits, improve outcomes. But if it was that simple, the American Medical Association wouldn't be releasing new private practice survival guides every quarter, and practices would be thriving, but they're not. Why? Because the foundation is misaligned, and you can't build a thriving system on top of a broken one. If you want to maintain a stable medical practice in 2025, you need to start with two things. Number one, you need clarity. You need a clear view of what's really happening behind the scenes, what's helping you, and what's hurting you. Number two, you need direction. You need to know where you're going and whether your current strategy is actually leading you there, and if not, what's missing. If your plan isn't built around your current reality, you're wasting time, energy, and money trying to fix the wrong things. If you haven't observed and audited your own medical practice, if you haven't looked at how your current systems and processes either support or sabotage your goals, then you don't need to optimize or increase anything yet. You need clarity first. Because the truth is, there are no cookie cutter fixes. Every medical office has a different dynamic. Your strategy should never overwhelm your team, disrupt care, or rely on more tech and more hiring to be successful, because all of that requires more money, and we're already losing. You don't need to do anything until you become aware of what's really happening. And to do that, you need to focus on two things: observation and audits. Observation, go look and see what's actually happening. Audit, analyze that, see what's not being tracked, followed through, or connected. Because until you can see the signals, you'll keep guessing. And that's how good practices get stuck. Let me give you a prime example of what I mean. One of my clients, a solo physician, we'll call Dr. Avery James, came to me exhausted, burned out, thinking about selling, thinking about walking away from everything they built. They thought the issue was staffing or burnout or maybe declining reimbursements. But when I walked them through a simple self-assessment I called, is it me, is it us, or is it this? Their answers revealed something deeper. They didn't want to run the business anymore. They didn't want to make leadership decisions. They didn't want the pressure of making payroll. They wanted to just be a doctor. But their reality, they was the sole decision maker. They carried the full financial risk, and they had zero support building a sustainable business model. That disconnect between vision and reality, that's what's fueling their burnout. Not patient volume, not staff shortages. You can't build goals around KPIs if they aren't grounded in the people who drive your mission. Your physician's vision sets the tone. Your leadership team translate that vision into goals, and then you build systems that support those goals. No more guess and go, because you're not just aligning team to goals, you're aligning intent to impact. With insurance models shifting towards pay-for-performance value-based care, now is the time to reassess and realign. Sustainable change starts from the inside out, from the top down. The leadership team driving this strategy needs to align their reality as well, because Dr. Avery's office manager and I uncovered a severe disconnect in the expectations from the doctor. American Medical Association has templates ready to fill out for physicians starting a new practice. And in the job description for the practice manager, it states responsible for executing the business strategy. Guess what? That's out of scope. Let me explain. Most people with healthcare administration degrees, BHAs, MHA, are trained in day-to-day clinic operations, staff coordination, scheduling, compliance and documentation, EHR management, accreditation policies. They are not trained in business development, market positioning, advanced revenue strategy, brand development, patient loyalty, pivoting practice models, going from fee-for-service to value-based care or private pay. They're trained to run the system, not to build it, not to evolve it, or strategically reposition the system. They are there to help it run smoothly. Then you can find post after post after post after post of doctors saying they weren't trained in how to run their medical practice successfully as a business. Here is some reality. Most practice managers are trained in operations, not business development. Most physicians are trained in clinical care, not practice profitability. We ask clinicians to grow the business without giving them business training. We expect practice managers to strategize without giving them strategic tools. You can't learn how to run a business just from reading it in some modules online. That's not setting you up for success. So when the system changes, when reimbursement pivots to value-based care, everyone is stuck trying to build a new ship in the middle of the ocean. That's not a staffing issue, that's a structural issue. That's also a setup for failure. But we're here now because nobody's coming to save us. Because here's what's really happening in most practices. The physician's intent isn't clear, the manager's capacity isn't aligned, the goals are disconnected from real outcome. So no one is sure what to measure, what to fix, or what to prioritize. This is why so many leaders feel like they're spinning their wheels. If you're unsure what to fix first, staffing, scheduling, revenue, it doesn't start with a new EMR or a new hire. It starts with auditing yourself. Because if you don't audit leadership first, you'll be trying to optimize and scale a model that doesn't fit leadership's capacity or vision. And no amount of staffing will fix that. So now that you've got the vision set, it's now time to steer that vision into goals. Clarity on organizational goals equals direction. This video is your starting point. It's the first part of a 6-part series where I walk you through the 5 core areas of your practice you need to understand before you implement change. What they look like, when they're broken, and what to do first to start leading your practice with clarity, confidence, and control. This is where your tangible goals will come from. In every practice I've worked with, the breakdown happens in one or more of these 5 areas. The way your team functions, the connectivity of your operations, the clarity of your processes, the outcomes you either are or are not measuring, and your ability to shift when the landscape changes. The healthcare industry is shifting fast from volume to value. Reimbursements are no longer just about how many patients you see, but how well they're cared for and how consistently you can prove it. This isn't just theory or entertainment. This video is your starting point. Each video in this 6-part series comes with a tool, a real-world, immediately usable resource to help you take action right now in your own clinic. No email required. And listen, this is not for people who want another checklist to save in a folder and forget it. This is for action takers, leaders who are tired of guessing, tired of spinning their wheels, and ready to make intentional, data-informed change. Because the reality is, your practice survival might depend on what you do this month. And that means doing more than watching videos. So here's what I want you to walk away with first from this video. If you're the physician, complete the alignment checklist tool, but answer it honestly, not just aspirationally. Do you want full control or do you want support? Are you still aligned with your original reason for starting the practice, or has that changed over time? What level of financial responsibility do you want to carry moving forward? Now, if you're the practice manager or part of the leadership team, your checklist is different. not about job titles. It's about what you're actually doing. Does your current role support the practice's vision? And if it doesn't, what needs to change to fit the strategy? If your clinic's leadership is misaligned, none of your operations, KPIs, or staffing fixes will matter. You can't improve what's not aligned. And you absolutely can't build a sustainable strategy if leadership is marching to a different drum and doesn't understand the goal. If you've been trying to fix things by hiring more people, buying more software, or just working harder, this series will help you see what's really going on underneath the chaos. In the next video, we're going to walk through what I call the people shift. We're not just talking about hiring or schedules. We're asking, what is the physician envisioning? How is the staff executing that vision? And how does the patient experience it? Do they feel like they're part of the care journey or just being processed through it? Don't sleepwalk into burnout. Don't wait for someone else to lead your clinic out of chaos. This is your starting point. Take the tool, no email required, use it. And if you know a practice leader who needs to hear this, send it to them now. See you in the next video.